Hey everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much more. I'm helping everyone, especially those over 40, optimize their health, hormones, metabolism, so they can live a life full of strength, energy, vitality. Gotta throw that out there so you know what the hell I'm talking about. So last week I started a little video series on PCOS because I have a lot of women who deal with this, and I read about this a lot online. It's a big problem, and a lot of these women need some help, right? So there's definitely a right way and a wrong way to do this, and the goal is to get you there. So if you missed that video, check that one out. So basically PCOS, again, we're talking about at the beginning, again, causes, okay? Again, as I talked about last time, the biggest problem is hyperinsulinemia and insulin resistance. And oftentimes it is a genetic factor. So sometimes it cannot be modified, but sometimes it is brought on by other factors, environmental factors and stressors, etc. But at the root, there's an issue with metabolically, and again, often it starts at the genetic level where there's just too much insulin and there's too much resistance to it, and it cannot be processed, handled properly, etc. Unfortunately, it tends to get worse over age. And as I mentioned last time also, this is a very common endocrinopathy. It is an endocrinopathy. It's not an ovary problem. It's not a GYN problem. It's an endocrinopathy. And it's very common, and it's frequently missed. And if you don't look for it, you're going to miss it, because oftentimes it's very subtle and it's not what people think. And again, there can be some signs in the ovaries, like enlarged ovaries, cysts, but most commonly anovulation. So this is women who have anovulation. They have missed periods, or medical term metrorrhagia, or they have irregular cycles, or they have problems, difficulty getting pregnant. Not always. Again, this is why it's frequently missed. It's a big masquerader, but it's a problem. I'm going to talk about why this is a big problem later, above and beyond just the missed periods. There's medical issues and health issues. A lot of these women have issues with hirsutism, or abnormal hair growth in places they don't want it, right? How many ladies out there have you had just a little bit of that extra hair growth on the lip or the chin, or maybe the back, the neck, different places where you don't want it? You have to shave or dilapidate, peel, all these different things. Acne is another problem too, same thing. A lot of these women have had issues with acne. And of course, we all go through teen acne, right? But oftentimes it's worse, or as they get older, it persists, right? And often hand in hand with the hirsutism. A lot of women have obesity and issues with the fatty liver. These don't always go hand in hand, but these are very common. Fatty liver nowadays is a big problem. It's getting more and more prevalent. I'm seeing it more and more in clients and referrals and consultations. And that can be an early sign of all these bad things to come. And obesity is a big one too, but again, not all women have it. A lot of women don't have it. A lot of women are thin, they have no ovarian problems, sometimes they don't have acne or hirsutism. So again, it can be easily missed. But these are two big problems. Of course, as we know, both of these can lead to additional problems due to the secondary inflammation, have more fatty liver, eventually more dyslipidemia, abnormal lipids, abnormal worsening insulin resistance, and again, prediabetes, hypertension, or high blood pressure, more obesity, more inflammation, cardiovascular disease, cancer, and much more. So this is something we don't want to have. And of course, as I mentioned, lipid abnormalities, what we call dyslipidemia. So people have abnormal profiles on their lipids, right? They're good. Their HDL goes down, which is opposite what we want, or their small particles go up, or they get some oxidized LDLs, etc. And I'll get into that later. But basically, abnormalities in their lipids, which of course can predispose them to health problems down the road. Again, of course, glucose intolerance and insulin resistance. And in real severe cases, some women get male pattern baldness too. This is not always very frequently seen, but this is another one too. So these are some of the common things that you'll see. But again, most of the time, and some things you'll pick up on lab work, which again, I'll talk about later. And that's the only thing you're going to see. So again, sometimes it takes some tuning and digging. It's not just, again, as I talk about all the time, it's not just cookie cutter stuff. You got to look at this and get a good history from the patient and look at their labs and put it all together. This is the art of medicine that can be very complex sometimes. I see a lot of women who've been to these mills and or just a non-physician provider or non-clinician. They're not treated properly because they don't know what to look for, and they get misdiagnosed, or they get put on the wrong treatment regimen or more. So, and this can have bad consequences, as I'll talk about later. So anyway, just want to give another our intro part 2 on PCOS. Let me know if you like this. Please like this post, tag it, share it, and DM me below if you have PCOS, know someone who has PCOS, or you need some help with your PCOS. I'm happy to help. Anyway, so DM PCOS below, and everyone have an awesome day, and we'll talk to you soon. Bye.